Hi everyone, it is day 4 since surgery. It was on Monday and wanted to give you another update. Um, Things have been going really well. Every day gets a little bit better. My pain pumps are gone and I still take my Percocet every 4 hours. The pain is getting a little bit better. I'm able to stand a little bit more upright, but it's still kind of tight, so I kind of purposefully hunch over a little bit just for protection for the sutures that I really don't want to tear. I am also on my antibiotic that I take every 6 hours, and I'll be on that until these drains are gone, and that could be 2 weeks. So interesting thing that I learned is that when you're overweight, you have a large lymphatic system, and even after losing the weight, it doesn't change. Like the size of those don't shrink. So when your body fills up with fluid, it can really fill up with fluid. So that's kind of what I'm dealing with. The surgeon already told me that that's going to be fairly likely. So I do have a follow-up appointment next week, and then one after that where we're actually going to talk about these wonderful arms, which I will talk about later. But I wanted to show you kind of the results so far and kind of, as my kids say, how I've been sliced in half. So I won't show you too far down, but you can kind of see where the incision is down here. I am more swollen on this side than I am on this side. Getting your body to be symmetrical is kind of a challenge when you're laying down. I still, like I said, I'm facing a lot of swelling still. So things are going to be changing over the course of 6 months to a year even. That's just how much things can swell. And knowing me, who is really good at retaining water, I probably will be doing it frequently. This whole area is quite numb. I can't feel anything, which is interesting because I don't know when my stomach is being exposed because I can't feel the air. So I always have to double check. I heard something funny from someone who had this done and said that when she was walking around or running, she couldn't tell when like her underwear was falling down because she couldn't feel it. So that's probably going to be something I will be dealing with anyway. So anyway, this is my new tummy. Again, I'm very, very swollen, but you can see where they've done the incision, and it goes all the way in the back, which is also very swollen, but it's also very flat, which is, it just boggles my mind. You can see kind of where the drains are. The incisions have started to scab over and do what they're supposed to do there. Turn around this way so you can kind of see there's bruising, obviously. I almost kind of look like I have a pregnant belly just because it's so swollen. But you can kind of get to see my new belly button where it is, kind of what they did to pull down the skin. There were things like up here that they didn't get to because it was more upper back than it was tummy. So obviously it would have been something extra for them to do. But for the most part, I feel fairly symmetrical. Like I said, on this side, it is a little bit more swollen, and my drains output actually really shows that. But this is really, really crazy for me when I'm looking at it, going, this is my stomach. And it's even weirder, too, because I can't feel it. So I guess I don't really know how to explain it other than it just being bizarre. But I wear a tank top underneath my binder, which I still will be wearing for several weeks for both comfort and support and to help with all of the swelling. So it kind of massages the lymphatic system and helps it to shrink. So that's the goal. It's not supposed to be like a waist trainer, I guess those things are called. It's really just to help out with the swelling, and it actually serves as a means of support for my abs when I'm walking. I still purposefully, like I said, hunch over a little bit. I have found pants that are too big for me, but they're perfect because they can go over the drains very gently without hurting me, which is a big bonus. Today I did manage to successfully wash my hair in the sink, so hooray, that's the second time I've done it, and I feel like I'll be doing it for a little while yet. I kind of have to bathe with washcloths until these drains are gone. And the reason that the surgeon wants that, obviously, is to prevent infection. I am on an antibiotic, but I'd rather not to have some outside fluid come into all these incisions because it's all the way around, and that could be really, really bad and really painful. So I don't want any of that. Anyway, I'm feeling better all the time. Right now, I'm just kind of suffering almost from boredom because I'm moving around like I'm supposed to, but I can't do too much. And I was always the kind of person that's always go, go, go. And obviously, I can't run, and I can't run for a while. So this is going to be an interesting challenge for me. But anyway, feel free to ask questions. I'll check in again maybe in 2, 3, 4 days and see where my incisions are and see maybe I'll be standing upright. And we'll go from there. So there you have it.